Hello, everyone, and welcome to Team TSI's training today. We are going to have a special presentation, and this is the second time we've presented this, but as you all know, there has been so many updates and such an overwhelming response to these trainings that we're providing that we really thought this would be one that we should do a second time. And I'm really excited for each of you that have joined us today. Please remember we are recording and also have some handouts available for you. So we'll walk through how you can get those handouts here in just a moment. So the first thing we're going to do is just a little bit of housekeeping, not only the handouts, but also how to ask questions. There's a number of us available watching for your questions, and we'll be answering behind the scenes. And also there'll be time for question and answers towards the end of the training. So if you're not familiar with the GoToWebinar, please find your GoToWebinar panel. And you can do that by simply looking at the bottom of your screen and look for the little blue flower. If you click on that flower, it will pop up the GoToWebinar panel if you've been, maybe multitasking and working on something else. What you're going to look for is the panel that looks similar to my photo number 1 here. If for some reason yours is not expanded, it could be collapsed and look like my center picture. So you simply click on that little orange arrow, it will open up and look like that number 1 picture, and then you're going to look for the line that says questions. When you click on the questions arrow, it opens up and then it looks like my number 2 question, which you'll notice I've got the big red arrow there that will show you where you would type your question in. You would hit send, and that will put your question up in our question pane, and that's when we'll be reviewing your question, answering you, or saving your question for the end of our training. So also, if you've noticed, right underneath that question line, there is a portion that says handouts. There's 5 handouts that we have attached there for you, and these are amazing resources. I can't wait for you to hear and see what has been prepared for you. This is all really to assist you during this time, so we want you to have this information, and the handouts, we can also send you a link and so on if you're having trouble retrieving them from the GoToWebinar panel. So please let us know if for some reason you're not able to get those handouts, and we'll be happy to send them over. So I'd like to introduce your team today, and for those of you that have been joining us for our weekly COVID-19 special trainings, you are now becoming familiar with our team that we're just so excited, and our experts that are providing this very helpful information. So as you can see on this slide, we have a number of people helping you, but today you're going to hear from Greg Seipel. He is our Vice President of Informatics. He's really leading our team in so many different directions and usually behind the scenes. So we're really pleased to have Greg sharing some of his expertise with us throughout these weekly COVID-19 trainings. And Hugh Heaton, you may not be aware, but he has, for the almost 10 years I've been with TSI, he has been an instrumental part of so many of the wonderful resources that we provide to you. And he is here today with some of his expertise and some of his amazing resources to assist you during this time. You can see down at the bottom, our support team is available at any time. Also, if you're needing your credentials or your senior account manager, you can reach out to them. And for the question and answers, you'll be hearing from either myself, Dahlia Croft, or Kelsey Little. So with that, I want to thank you for your time and attention today. We are just honored to have you. And if there's anything that we can do for you, please reach out. With that, I'm going to turn it over to Greg.
Well, thank you so much, Dahlia. So we've given this presentation once before, but again, the information is so on topic with everything we're dealing right now with the COVID-19 pandemic that it felt definitely prudent to repeat the information and offer the training session again. Again, we have the great pleasure of being joined by Hugh Heaton. And again, if the name seems familiar to you, if you've ever utilized or are familiar with the Heaton manuals, he was the father of those documents, and it's always a pleasure and always a joy to be able to work with you and present anything with you. And the quality, as you'll see, is just beyond reproach. So what we're trying to accomplish in today's session or goals is obviously, number one, provide an overview of the personal protective equipment and hygiene practices that will be utilized. Value, do I have clicker control? Oh,
Yes, yes, you do.
it's fighting with me.
Is it?
Yeah, it's not letting me advance.
Let me try enabling it. Sorry about that, everybody. Let me try one more time. All right, there we go.
There we go. So some of the things that we've been dealing with and we've been facing, of course, infection control focused survey process. So when they revised with the advent of COVID-19, and they basically came out with a new focused survey related to the infection control process specific to COVID-19 and all the ramifications that go along with that. We did a training on that just last week as well, on how we can best prepare for that and what you will need to be prepared for in the event that surveyors would walk into your facility. PPE utilization, there's been an enormous amount of information coming out based on this. In fact, I believe there was an update just this morning that caused us to revise one of the handouts in regards to glove utilization. And Hugh's going to go over all the information based on that as well, the optimization of PPE, of course, hand hygiene practices. And this, of course, is the foundation of any infection control practice. You know, doing the good hand hygiene, having accessibility to alcohol hand rubs. That's information that is definitely prudent to everything that we're dealing with. And of course, your training, education, and documentation of outcome. As always, we've all heard the adage before, if you haven't documented it, it didn't happen. Well, in so many of these reviews and oversights in multiple agencies that are now involved in monitoring and oversighting practice, there's a huge focus on review of documentation, not just involving your infection control surveillance process or your infection prevention and control program, but documentation of observations and a lot of training and skills validation. And are you continually monitoring to ensure that staff are practicing appropriately in the healthcare setting? That documentation is paramount in a number of surveys that not just the Department of Health, but if you're looking at something from OSHA or the CDC, and Hugh will go over some information based on that as well, it's just been eye-opening on the number of people involved in monitoring this pandemic. And of course, the resources and handouts, the information is going to be provided specifically in relation to the personal protective equipment and the hand hygiene, how it can dovetail into your quality assurance and performance improvement program, the documentation or resources that you will need to be able to demonstrate compliance. And even as we were speaking briefly before we started the presentation, it might be difficult in this trying time when with short staff situations and everything you're doing from an emergency response to meet all of the requirements. There is some credit being given for a good faith effort to ensure that as long as you're doing something, you're doing some effort there to ensure your staff is safe and educated. And then ever-changing landscape in long-term care, boy, is it ever. We have seen so many waivers come across, the blanket waivers that have come across, and that's something else that we are looking to probably do a training for as well, especially in relation to the federal tags that are associated with it. The guidance for the infection control and prevention in the QSO 2014 that came out. That was followed again by the guidance for use of certain respirators by healthcare personnel, and what we've done all the way down to including cloth face mask coverings and ensuring you're fit for the type of respirator that you might be using. We did see the prioritization of survey activities come out in QSO 2020. We're not doing standard surveys right now, but they are still doing complaints. And of course, they're doing the focus COVID-19, especially in complaints in the event that it may be linked to an immediate jeopardy type of finding. And again, once they're in the building, even though it is a focus survey, everything is open to review as always. And if they find a different area that could lead to concerns of immediate jeopardy, they will investigate. Even so far as the COVID-19 reporting requirements that literally just got released, effective May 1st, first reporting requirement due this Friday, and everything that's gone along with that and trying to get registered with NHSN to make sure that you can submit that information and how you'll submit the information and gathering it. Boy, an ever-changing landscape is right. And again, just releases coming out regarding use of personal protective equipment that we've just seen even as early as today. So remember, in the infection control focused survey process, they do look at the effectiveness of the infection prevention and control program. And it focuses really in three main areas. They are looking at your hand hygiene. This is your #1 defense against spreading any type of infection, especially COVID-19. What are the hand hygiene practices? What are they seeing on observation? What type of training information do you have? They're looking at your personal protective equipment. There are a lot of tools out there from the CDC. Hugh has managed to pull together an enormous amount of data related to this. Wonderful tools, educational materials, auditing tools as well to make sure that you're staying on top of this. There's a burn rate calculator from the CDC that they made a little bit more user friendly. And standard and transmission-based precautions. What is the practice being utilized for isolation? Are you following the isolation criteria, cohorting of residents where possible? If you're taking admissions based on this, are they going into, or even during this time, are they going into a 14-day observational period before they wind up coming into the general population, so to speak? And of course, education, monitoring, and surveillance practices. This is really competency evaluation, validation of the training, and observation. You cannot do enough observation and you cannot have enough documentation to protect yourself in this. It's really a new world order, as we were speaking earlier. It's the world has definitely changed in response to COVID-19. The infection control practices are under a level of scrutiny that we've never seen before. And the greatest way to prevent the spread of this is definitely through hand hygiene, personal protective equipment, and adherence to your standard and transmission-based precautions. So without further ado, I'm going to turn it over to Hugh, who is going to basically walk you through the materials that he's created, that he's offering with no expectation of anything in return. Again, it's been such a wonderful pleasure to work with Hugh on all of these issues as they keep arising. And I've never encountered a more knowledgeable person with a breadth of knowledge to this topic and anything from a regulatory standpoint. So Hugh, take it away.
Thank you, Greg. A lot that we want to look at this afternoon. I know you're all extremely busy, so we'll just get right to it. As Dahlia mentioned, there are handouts. There are 4 that we want to look at, and the first one will be your hand hygiene in-service training program. There is a protective equipment in-service training program. We're going to look at an observation tool, and then we're going to look at some questions that CMS has received, and they published in April 24th, and some of those deal with the survey process, so we'll look at some of those. But first, I want to go through your hand hygiene practices, and what I want to do is walk through how the program is organized. And I think you will find that it's extremely comprehensive, but it's very easy to use. Both the hand hygiene and the personal protective equipment are done the same way. So just going through the hand hygiene, the first thing you have is your PowerPoint presentation slides in a PDF format. So it has all of one of the major areas that we look at is to provide you with where does this information come from? What sources do we use? So we provide that information. Then all the information that's in blue is linked, but it's also bookmarked. You'll find the bookmarks extremely helpful in navigating the program. But these contain your presentation notes, and you will find them extremely easy to use. In fact, we know how busy your staff is. If you don't have time to complete an entire training program, it may be that you want to just provide them with the slides that provides the teaching notes to them, especially your management team. where they can just look at that because it has a lot of helpful information in those. So I want to just go through the slides. The first thing it does is provide you with the session objectives. The reason that that's important is in the new survey process, when we're doing a plan of correction, when we indicate on that plan of correction that we have conducted or going to conduct an in-service training program, what CMS is looking for today is, was that training program successful? And what tools did you use to measure that? So I am seeing where plans of correction are being rejected because it didn't have what was the outcome. Was the training program successful? And how did you measure that? So we've put the session objectives in there so that they can be measured, and it provides all kind of data for you to look. You can modify it to meet any particular need. It goes through reasons staff give for not performing hand hygiene practices, but it also gives you a suggestion. Before reviewing the reasons, ask the participants why they don't necessarily perform hand hygiene, and compare what they have indicated versus what you have on the slide. Sometimes you may want to modify your training based on some of the comments that you're getting from those who are in doing this every day. So as you go through all of the slides, you will find all of the teaching notes, and where it provides for a handout, that handout will be linked. So you'll always be able to get to the data if you want to do that. It talks about the 5 moments of hand hygiene. These are the World Health Organization's 5 moments, 5 key moments. We've all seen those. So when you get to this slide, that handout number 2 is that. So you may not want to provide this particular handout to the staff, but you could print it and post it in work areas, which would be helpful. But all of the data's there, and it goes through all the key moments. It gives when you do that, and then it gives some examples. They're not all inclusive, but it goes through every one of those 5 components. And that's going to be, we're going to go back and look at this in another format in just a moment. So it has all of the data that you have all the way down to your questions and answers. And it encourages your staff to ask questions, and that's important. But in order to help do this, you have participant handouts, and what the program has hopefully tried to accomplish and succeed in that is, when you're doing a training program, there are many documents that you need access to. Currently, we have to go to several different websites to locate the data. Then when we locate the data, we can't just download it. It's in an HTML file, which is all over the place. So we have to put it in a Word format or put it in a PDF format. So that takes a lot of time to do that. So you get frustrated trying to locate all this data. So what you're going to have in these lesson plans and these in-service training programs is all the data is in one file. So if you're looking at all of the handouts, the first handout is your session outline. This is a scaled down version of your slides where your staff can make notes. And it's the exact same information that's on your presentation notes. The only thing that's missing are the notes. So what you're teaching from your training program, if you want your staff to have a copy of that, these slides are identical to what you're teaching. It also has all of the different handouts that's mentioned in the training program. They're all here. They're all linked. very easy to get to, and they're all in a printable format. The document is designed to be printed. If you want to print it on two sides, it's designed to be where the documents and information print correctly, and that's always helpful to be able to do that. It also has a couple of forms. It has the competency validation checklist. If you want to validate, and surveyors are looking for this, how did you validate their competency? So here's a hand washing competency validation checklist. Did they do these steps and did they do them correctly? But we notice what we did with it. We put it as a copy document so that the information can be protected through the copy program. Now, that doesn't mean that all your copy documents are not discoverable. They are. It's just that the survey team, if they look at this document, cannot use any information on the document to cite the facility. The other thing that we're looking at is Greg mentioned in his presentation the blanket waivers, and we've been studying that, and we're getting ready to do a program for that because we began to evaluate how did those waivers, how does that affect the survey process, and we found a tremendous amount of information that that's being left out. When they publishes this information, they're not. It's a little deceiving. But one of the things that was modified was the copy program, and in that program, when we first look at that, we think, well, they've waived all of the copy tags. No, they did not. What they did is waive what they want the copy program to do is focus solely on infection control and adverse events through this public health emergency. So the copy program has only been modified to only focus on infection control and adverse events. So we place this document in a copy program to help protect some of the information. This is the demonstration, but what is the head knowledge? Because they are interviewed during the survey process. They are being asked questions. How do you do these things? And explain this to me. So we created a 15-question exam. It's all true and false, all based on the CDC and regulatory process. Very easy questions to do, but it's also placed in the copy program. You also, it's designed to, if I want to just look at, let me bring that up just a little bit. When you look at the document, you'll notice that it's what shift are they on, what position or department, where's the work location, and are they employment type, facility staff, contract, consultant, even a volunteer. Under these infection control rules, a volunteer, a consultant, a contractors, your therapy department, others, your facility staff, full-time, part-time, they are all considered staff members. And so when you do these programs, you may want to consider, or if you're using volunteers, they have to be qualified. So you can compare. Maybe I just want to look at first shift on East Wing. I can do that very easily. It's very easy to do. So you look at all of these and you think, well, where's the answers? When you go back to your presentation slides, we looked at the last slide is always questions and answers. But it has all of the answers and where that information is located in your program. So if you have someone who asks you for a clarification, or where in the program did that information come from, you have all that data at your fingertips. So if I'm looking at question number 9, I can go to slide number 9 and it will or link directly to that particular slide. So when you're looking at all of that data for your exam, you have the questions in your handout. You have the answers in your handout. The next part that's in your handout is your support documentation, which is very critical. You have a record of training. That's important. So when I'm looking at the record of training, one of the questions that it asked, we discussed it, was a comparative analysis. So when you're looking at that, it's asking you the question, was there an improvement? We modified this document so that it works in direct relationship to how you would answer a 2567. So all of that information is there as well. It also has your record of attendance, and all of it's pre-filled out. It has your competency evaluation or a participant evaluation form if you want to get feedback. That document is there. All of these documents are there to support the validity of your training program because a lot of your survey agencies, CDC, OSHA, and all of those agencies are looking for this type of validation of your training program. It also has a certificate of completion. So that supports, you can put this in a staff member's file, you can make a copy for them, but it supports that person attended that training program. And let me tell you why that is so important. I have a very good friend who is a life safety code OSHA consultant to several facilities. Greg and I were talking yesterday about how the OSHA survey is affecting the infection control, and it is. You've got 3 different agencies surveying for infection control, your hand hygiene practices, and your personal protective equipment. You have CDC, who now have the right to come into your facility and observe. And what CDC is looking for is your observation program, not your validation, not your competence evaluation exam. They want to know how you're observing and how you're using that. And then you have OSHA. OSHA is looking at that. Most of the OSHA surveyors are not going to come into your facility, especially if you have a confirmed COVID-19. They're not going to come in. However, they are sending to you a 4-page request for information. In talking with Dahlia and Greg earlier, we are looking at putting together a program that uses that document. My friend sent to me an actual OSHA compliance information request document. And so we're restructuring that to make it a QAPI document. And so we hope to have within the next couple of weeks have an OSHA program. But OSHA is looking for one of the questions that pieces of information that they're requesting is this information. They're looking at if they come into the facility, they're looking for specific employee based on complaints. And so they're wanting to know, they're looking at the training record for a specific person. Not maybe the entire facility, but they want to look at, say, the training program for Greg on his exposure control plan training. They want to see that training record. So this will help you comply with that. The next program is your personal protective equipment. I'm not going to go through all of that. is designed exactly the same way as your um, hand hygiene. Has all of the your session objectives, has all of the training notes. Everything is linked. It does have your has some really good handouts that you can take these documents and print them and post them. These are actual CDC documents, uh, very good documents. There is one here on how to properly put on and take off a disposable respirator. That's a really neat handout, or that you can post. There are two other things that we did with this one. This one has a competency validation checklist. It's different from the hand washing because it involves it's a little bit different, and it's a validation checklist. They do all of these different things. It also has an exam so that you can support not only uh, they can demonstrate competency, but head knowledge. They can also demonstrate knowledge. It also has all of the different um, OSHA and CDC guidelines on optimizing your personal protective equipment supplies. When you look at this document, it has all of the OSHA and these are all of the CDC documents that deal with how do I optimize my supply. Greg mentioned that we did an update. We did. CDC released this new one. It was published April 30th, but we don't always know that they've updated that. And sometimes even though they say that it was posted on a certain day, it may have been to their site, but it was not available for 2 or 3 days. But anyway, this one is a new one. This is an updated for optimizing the supply of disposable gloves. Just we uploaded that, changed this handout so that you would have that information. And it goes through, and you will find all of these documents are bookmarked. We don't just put them up there. Now, when we talked about going to the OSHA website or going to the CDC website, if you go to CDC and look for this document, you can find it, but it's not going to be in this format. Um, TSI wants to make sure that the documents are easier for you to read. So it has all of that document. It also has all of the OSHA documents. This one was these deal with your respirator use. So all of this document or this particular training session has all of the support documents, and that's what makes your training program so effective. That you can support where the information comes from. But I want to go to the third handout. OSHA and CDC and CMS. I listen in on several different states' health department what they're telling their members, and CDC is participating in those. And what CDC is asking for is your observation, not necessarily your validation, but how did you observe hand washing practices? There are several out there, and they're good. But what we did with this is we placed this document in the QAPI program. To me, that's critical. As an administrator, I put things in the QAPI program. It's important to have it there. But in addition to that, it has the administrative guidelines that drive it. And notice the very first one, this hand hygiene observation process is not intended to be used as a training tool. Its purpose is to observe hand hygiene practices. So we're going to observe those 5 key moments. That's what we're looking for because that's what our training is based on. That's what the World Health Organization teaches. So this observation is based on your in-service training program, and it talks about how to do that. So you have it. It says that you're not using this as a tool to punish a staff member. What you're doing is you're observing. The instructions indicate that you are not to inform that staff member that you are observing them or that you are to provide them any information. You're only observing. So your training program or your administrative guidelines provide you with detailed instructions on the form. So I want to look at the form basically. I want us to go and look at that. Not sure how much you can see of that. But this is an observation form. Let me close this. So what you're looking at is you can do it by shift, you can do it by day of the week, you can do it by job position. There's all kind of ways that you can compare. You don't have to do your whole facility. That's not the purpose. You may only have a problem in a specific area. So what you're doing is it provides for 10 observations at one time. You can do 5, you can do 3. But who are you observing? And then what you're looking for is, prior to touching the resident, did they perform hand washing or use a hand sanitizer? Or did they use both of them? So you're observing it. All you're doing is placing a check mark here. That's all. Then you're going to look at what the results are. I'm going to total all this up, and it gives you all of the instructions on how to do that, all the formulas. But the other thing that it asks, and CDC looks at this when they're observing, so does OSHA. Are hand hygiene supplies available? Were any of these a problem that may have caused the staff member not to wash their hands? Could that have been a part of it? The second part of this form is your analysis. Very easy to use. I'm just going to take the totals from this part and I'm going to put them here. Which one of these 5 did I have the greatest problem? It may not, instead of us trying to train on every one of the hand hygiene issues, it may be that you only had an issue after touching the resident or touching the surroundings. That may be the only thing that you need to train on. So that's a tremendous helpful tool. You don't have to train everybody on everything, and it will save a tremendous amount of time. And this form provides all of the formulas. Everything is ready for you to utilize the data, and you don't have to do it facility wide. You can tell quickly if I want to just do North Hall and I only want to do 3 staff members. That will tell you whether you have a problem or not. And you can do it by shift. You can do it in many different ways. Then it gets the third part of it is your worksheet. Where is my problem? For example, what staff position had the most yes responses? How many had no? So it just keeps stepping down for you to find the root cause. And here is your root cause analysis. So this is where the survey team is looking for your observation and your QAPI process. Remember, the QAPI program under the blanket waivers is strictly infection control and adverse events. So we've provided this information and where and how easy it is to identify which one of these areas you need to train on. You will really like this. It also has the same competency validation checklist as as the training program had, in case you may not have access to one document in a PDF form. you would have it in another one if you want. And this document is a standalone document. It's not attached to your training program. The reason for that, it's an observation program. So the next thing we want to look at is some of the questions that's come out from CMS on a lot of the questions. And it's divided into these 4 areas, and we have bookmarked them, so you don't have to scroll through the document like this and look at the questions. The questions are here. So if I want to know, are there any resources available to help nursing homes facilitate virtual visits? So here's the question and the answer, and it goes into individuals entering and leaving the nursing home. There's questions there about what type of health care workers are allowed to enter a nursing home. So these are answered by CMS. You will find this extremely easy to use because it's bookmarked. You can look at the questions over here without having to scroll down through the documents. But where I want to focus on, and it has waivers, talks about that, resident cohorting, separation, and admission. There are 3 questions on that. But then it gets into the survey process. Talks about, and Greg mentioned this, QSO 2020. Can you summarize what that memorandum's about? And then it talks about your focused infection control survey process. What is that? But it talks about an assessment tool, including a new focused infection control survey process. In the session that we had last week, and what this document is referring to is the COVID-19 focus survey critical element pathways. And it's a 10-page report or so, and what it does is what the surveyors look for when they come into the building. And what they're wanting you to do is to utilize that to self-assess your own facility. Now, is it required? No. That question is asked. Does the self-assessment count as an official survey? It does not. However, when you go to read the answers and the other data, it says, but the survey team will use this, and that constitutes an official survey. So you'll like this document because it addresses some of the survey issues that you're having, and this is the latest document that CMS has put out. So you'll find the documents extremely user-friendly. I hope that you use the data. If you're having problems downloading the information, let Dahlia know or the support team know, and they'll get you to the information. But you will find the training programs extremely comprehensive, and download them, use them. It'll save you and your staff a tremendous amount of time. I wished I had these when I was an administrator. I had to get out so I could write all of these. So that's all I have. If you have any questions, I'll certainly attempt to answer those. Dahlia?
Thank you, Hugh. That was amazing. Actually, Kelsey and myself have answered all of the questions. If anyone has any questions that you would like for Hugh or Greg to answer, please go ahead and send those to us now. Most of the questions that we handled were about the handouts. So if for some reason you're having trouble retrieving those handouts, we'll go ahead and do kind of a blanket email and send everyone a link to the handouts. So if you're not able to get those, we'll make sure that you get a link here shortly. And other than that, please remember that this is also recorded. So if someone wanted to attend but they weren't able to, you can definitely get the recording, and we'll send that over to you also. So anything you'd like to add, Greg or Hugh?
Uh, yeah, I just wanted to say, it feels right now in the midst of everything that's happening, we're sort of being assailed on all fronts. And if it's not, a focus survey for COVID-19 or a complaint from the Department of Health, it's the potential of the CDC coming in based on information they find to do observations, which they then will share with the Department of Health, or OSHA, if an employee's complain that they feel unsafe in the work environment. It just seems to be hitting from all sides. And I just want to thank everybody for everything that they do every day. Special shout out to the nurses. Happy Nurses Day. We will get through this. And as the kind of the tagline has been, we'll all get through this together. But again, I just wanted to thank Hugh for the information that he's put together. You have not only the training materials to be able to adequately train your staff, but all the documentation, the education, the observation, the validation, because they will look at the effectiveness of the program as one of those hallmarks as to whether or not you're achieving compliance. So again, Hugh, thank you so much for all your hard work in this. And again, thanks to everybody who was able to get on the training. Please be safe and be healthy, and thank you again.
I do want to express my appreciation for what the profession is doing. It's an honor to be a part of this profession. We may be in the limelight, but the good thing is that we have a caring heart. And I don't know anyone in this industry. If you're in this profession, it's because you choose to do that and you choose to serve others. And I want to tell you, I really appreciate that. And anything that I can do or Team TSI can do, if there's documents or something that you need, reach out to us. If we don't have them, we'll see if we can locate them for you.
Wonderful. Well, thank you so much. And thank you to all that spent your time with us today. And thank you for that, Greg and Hugh. We absolutely are honored to be a part of your team. So thank you, everyone. And this concludes our webinar today. So thank you, everyone, and have a wonderful week. Bye-bye.
Thank you.